This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet. Free monthly meetings include vegetarian experts found locally and on the mainland, quick and easy cooking demonstrations, and healthful and delicious food samples. Members enjoy an informative quarterly newsletter, social activities, and discounts at many vegetarian-friendly restaurants and health food stores. For an application, call 944-8344. That's 944-8344. Or visit our website at www.vsh.org. vsh.org.
Hi, everybody. Welcome to the monthly public lecture of the Vegetarian Society of Hawaii. Thank you for coming tonight. The Vegetarian Society of Hawaii is celebrating our 20th anniversary this year. From a handful of pioneering founders back in 1990 to being one of the largest vegetarian societies in the nation, we've continued to promote human health, animal rights, and protection of the environment by means of vegetarian education. We want to thank you very much. We couldn't have done it without your support. So give yourselves a pat on the back. If you're not a member yet, this would be a great time. You can just sign up tonight and start receiving our informative newsletter, as well as some great discounts at vegetarian-friendly restaurants and natural food stores, including Down to Earth. Stephanie Tapia for bringing our refreshments from Down to Earth. Yay! Cerelac at the reception table. Our wonderful Pat again, and Cerelac at the literature table, which she's going to be going to in a few minutes. UH Professor Emeritus Carl Seff, who brought our speakers late tonight. Dr. Bill Harris at the video camera. And Bob Leach, Carl, and Stephanie again in the kitchen. Please raise your hand if you came tonight because you saw this flyer. Wow, okay, great. Thank you. We also invite you to be sure to stay after the talk and have some delicious vegan food courtesy of Down to Earth. Again, we're also taping tonight's lecture for broadcast on the VSH weekly TV series Vegetarian. On Oahu, you can watch it on Olelo Channel 52. See our website, vsh.org, that's vsh.org, for the viewing schedule. You can also go to our website for a lot of other great information, including recipes, our famous restaurant guide, past newsletters, and even a link to our new Facebook page. It's now time for our special guest. We're delighted to have with us tonight Terry Shintani, MD, JD, MPH, and KSJ. Dr. Shintani is a Harvard-trained nutritionist and physician. He currently serves as the Associate Chair of the Department of Complementary and Alternative Medicine at the University of Hawaii Medical School. And he is on the National Advisory Board to the American College of Lifestyle Medicine. He is the author of the Eat More, Weigh Less diet and the Good Carbohydrate Revolution. His program won the highest national award from the United States Secretary of Health, and he has been featured in Newsweek, CNN News, CBS This Morning, Dateline NBC, and the Encyclopedia Britannica. This evening, Dr. Shintani will present the Health Crisis Cure, How to Get Off Your Medication with Your Doctor's Help. Please welcome Dr. Terry Shintani.
I want to thank you all, first of all, for allowing me to spend this time with you. I feel very privileged because they have a lot of distinguished guests for the Vegetarian Society, so they invite me back again and again, so I appreciate the honor. Tonight's topic is a health crisis cure. How many of you believe we have a health crisis in this country? That should be everybody. How many of you think our health care system is failing? And that's just about everybody. We have a huge problem in this country. I think we all know that. And we now have a concerted effort in Congress to, how do we say it, revolutionize the healthcare system or reform the healthcare system, because we all know it's broken. What bothers me most of all is that they are missing the point. How many of you think they're missing the point? Sure. They are trying to move healthcare dollars around they're trying to distribute it from the rich and give it to the poor, or they're trying to move it from the insurance companies to a public option. They talk about, a lot of folks are worried about healthcare rationing, right? But the truth is there's rationing now. Do you know what the rationing is? The people who have money get it, and the people who don't have money don't get it. And so they're trying to change that. I think they're really missing the point, because the biggest thing they're trying to do is improve the healthcare system, right? What they're missing is they're not trying to improve health. How many agree with that? Because you see, if we don't improve health, no healthcare system is going to be able to afford the amount of care we need. If people keep getting sicker and sicker and sicker, how in the world is any healthcare system? I don't care how good it is, how well it's distributed. I don't care how you do it. If people don't stop getting sick, if they don't stop eating junk, if they don't stop using medication like crazy, and of course they may need the medication, but if we don't turn that around, there is no health system on earth that's going to solve this crisis. So I'm here to talk about that, and I think one of the issues is going to be reducing the need for medication rather than figuring out how to pay for all this medication. So that's the topic for tonight. Before I go any further, I want to let you know that I do a lot of my work through the Hawaii Health Foundation, which is a 501c3 nonprofit organization. Dr. Diane is the administrator of the foundation. One of the things we do is a weekly radio show, Healing in You, on Sunday nights at 8 o'clock on K108. Dr. Ruth is one of our co-hosts. Dr. Ruth Heydrich. I think many of you know her, but if you don't, she was formerly president of this organization and a world-class athlete. And we've done actually nearly 800 community presentations like this because we feel that the healthcare system is broken and we're trying to do our part to fix it. And as you know, I've written a number of books. I donate 100% of the royalties into this foundation to promote health in Hawaii, and now that we have the internet, as far as we can around the world. I'm showing you this slide. It's a little complicated slide, but what this shows is our healthcare costs. And you can see that the United States healthcare costs are going up faster than just about anyone. And if you compare our healthcare costs, it's actually about 15% of our gross domestic product. It's higher than any of the civilized or industrialized nations. And it's going up faster than inflation. It's done that every year, year after year, and there's actually no end to it. And one of the biggest problems is our healthcare costs are out of control because pharmaceuticals are taking up a bigger and bigger proportion of our healthcare dollar. I mean, this is hospital care, office visits, but pharmaceutical costs are way out of control. And to demonstrate this is a slide describing the use of medication. I know it's a complicated slide, but this is the total average. This is under 13 years old. This is use of pharmaceuticals, prescription medicine. This is 13 to 44, 45 to 65, and 65 plus. And this is years 1999 to 2002 and 2002 to 2005. In any case, you can see the numbers are going up and up and up. In fact, during this period, in the recent period, 89% of adults over 65 were on a prescription medicine. 89%. That's like 9 out of 10. And it's risen compared to the 3-year period before. Now, how many of you think this is good for our country? 90% of us on prescription meds. Isn't this kind of a horrifying figure? Yet, I believe I remember one of the officials, may have been the president of AMA, saying, wow, this is a good thing because it means we're all compliant, the doctors are getting the patients to be more compliant on their medication. Oh my goodness. Do you see how far out of touch with reality some of our most important healthcare figures are? This, to me, is a sign that our healthcare system is about to fall apart because our health is falling apart. I mean, look at this. Kids are now on medication, prescription medicines now. How in the world do we say that that's good health care? What it is good for the pharmaceutical companies, and that's about it. The problem is our health is out of control, not our healthcare system. Our health is out of control. And I'm going to show you this. Many of you have seen this before, but how many of you have not seen the statistics for obesity in the last 20 years? Yeah, many of you have not. But if you've seen this before, I think you'll see that I have even more updated statistics. This is 1985. Now, bear with me on this. Follow with me. These are slides showing the obesity rate in this country. The darker the blue, the greater the obesity. And when it turns yellow, it's a caution. And when it turns red, it's highly alarming. This is based on the percentage of the population within each state that are obese. So watch this. It's 1985. You're going to see an epidemic sweeping across the country because, as you know, with obesity comes heart disease, cancer, stroke, diabetes, arthritis, etc. Here we go. 1985, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 97, 98, 99, 2000. It just keeps going. 2002, 2003, 2004, 2005, 2006, 2007, 2008. Isn't this a frightening picture? It literally is an epidemic sweeping across the country. This country is poised for a tsunami of chronic disease because these people, as they get older, are going to get high blood pressure, diabetes, strokes, cancer, etc. And this is coming upon us. So how in the world is any healthcare system going to handle this when the people, let's face it, back in the 1990s, when the figures started, we were already in an epidemic of heart disease and diabetes. Look what it's going to look like, see what it's going to look like now with this many more people who are obese. We have kids. If you read these statistics, it says 6 million kids are seriously overweight. This is year 2000. In 2005, it was 9 million, 50% rise in obesity over a 5-year period. Here's the leading cause of death in this country: heart disease, cancer, stroke. Heart disease actually went down, and you got to say that was a good thing. But what sneaked in here was Alzheimer's disease. Alzheimer's wasn't even in the top 10 until the last few years. Do you know what's really interesting about this? The largest selling drugs in this country is statins. You know what a statin is? It's a cholesterol medicine. And they credit the use of statins for reducing the rate of heart disease. You know what they're finding now? I saw a report not too long ago showing that statins cause memory loss. Does that make sense that now you see Alzheimer's creeping up? A lot of people that I see as patients would rather die of a heart attack than die of Alzheimer's. I'm not sure the medicine is doing us that much good, right? Because the side effects are starting to become a problem. And here's another statistic that you should be aware of. A new leading cause of death has sneaked in as number 4. It's not on here because it's not a disease. Do you know what that fourth leading cause of death is? What is the startling new cause of death? New fourth leading cause of death? Here's a clue. Michael Jackson, Heath Ledger, Danny Gans. Do you know what they all died of? Prematurely? Prescription medication. Prescription medication, according to the Journal of the American Medical Association, is now the fourth leading cause of death. Now, put this in perspective now. You have heart disease, cancer, stroke as the number 1, 2, and 3 cause of death. And then further down the line, you have diabetes. And what are we doing to protect us against these diseases? To prevent the deaths from these diseases? We're prescribing more and more medication. Does it make sense to keep doing that when that's now the number 4 leading cause of death? I don't think so. I think something has got to give. And this is really another sign that our healthcare system is hitting the wall. Do you know what I'm saying? Right? We've got all these health problems, and now our answer to the health problem is itself becoming a serious health problem, the 4th leading cause of death. So you know we have to find a better way. So why is America getting fat and sick? Well, the obesity epidemic is part of it. On this slide you can see obesity rates, the U.S. white population, African American. You see Native Hawaiians have double the rate. You know, I worked with Native Hawaiians for many years, and they have a terrible problem with obesity. So, how many of you think that that's a genetic thing? Well, why wouldn't you think that? It's double the rate, you know? You don't see that many 400, 500, 600-pound patients among the general population like you do in the Native Hawaiian community. A lot of people think, how many of you have heard, well, it's all in the genes, right? How many of you have heard that? I've heard that. But it's a myth, because if it were all in the genes, then 250 years ago, the genes were pure, there should have been more obesity, right? But was there? This is a picture drawn by Captain Cook's artist in the 1700s. How many obese Hawaiians do you see? You see none. So now I ask the question again, is it all in the genes? And you know what your answer has to be, right? It can't be. Because if they were slim back then, and they have pure Hawaiian genes, then it can't be all in the genes. There's something else going on. And if you don't believe drawings, here's a couple of photographs of Hawaiians who are slim. In fact, their main food was taro. Taro is mostly a carbohydrate. How many of you have heard carbs make you fat? Well, if carbs made you fat, why aren't the Hawaiians fat? They have the genes, and they're eating taro, which is mostly carbohydrate. And in fact, if you analyze their whole diet, it's about 78% carbohydrate, much higher than the modern American diet. If carbs made you fat, why aren't they fat? I've never heard anybody give me a good answer. And in fact, whole unprocessed carbs have been the main staple for humanity throughout civilization. Europe, they ate wheat and rye. In Asia, they ate rice. In the Americas, they ate maize, corn. In Egypt, they had barley and millet. This is barley in King Tut's tomb. All around the world, throughout all the great civilizations, they were consuming a diet that was centered on carbohydrates. And there was no obesity rampant among these cultures. You see, what's happened is, in ancient times, we ate very little fat, very little sugar or processed flour. We ate mostly whole unprocessed carbs. Animal products were optional, very small amount. Today, we eat a diet that is close to 40% fat. We have a record amount of sugar, consuming a record amount of refined flour. And what used to be our main food, whole unprocessed carbs, is now a side dish. Do you know what I mean by that? Do you know what I mean? When you get a plate lunch today, how much whole unprocessed food is on there? Think about it. Well, you have white rice, that's processed. You have macaroni salad, that's double processed. That's white flour and mayo. If you have a burger, you have a white flour bun. If you have the hamburger itself, it's a cow that's been fattened up artificially. The only real food on there is maybe the iceberg lettuce that's under the chicken cutlet. And the main food for Hawaii used to be taro. What's the main staple for Hawaii today? Spam. You know this, right? You know I'm not kidding. I didn't draw this cartoon. I found this in a cartoon book. It's a Hawaiian staple food. Well, Spam is a high-protein food, right? Well, didn't Atkins and the high-protein people say we're supposed to be eating protein, right? So how many of you knew that Spam is only 17% protein? Do you know that? It's 83% fat. And that's part of the problem we have. And it's highly processed, obviously. And so we see a big change from what we used to eat to what we're eating today. And you know what? The change in diet causes different genetic expression. Even though the genes are the same, the expression is different. Oh my gosh, what a concept. They're now finding that change in diet doesn't just change your blood cholesterol, doesn't just change your blood pressure, it changes your genetic expression. So I'm going to show you what's happening to humans now that they're eating differently. We change our diet over the years and we start looking like the food we're eating. You get the point, right? Humans are now looking very different. Actually, you can see it here. If you look at Japanese tourists, typically they're slim. You look at their Japanese relatives whose ancestors moved here a generation or two or three before, you can tell a local Japanese from a Japan Japanese. The local ones are fatter, right? And so this is part of the answer. America is afflicted with lifestyle-related disease. We're looking at obesity, heart disease, hypertension, diabetes, headaches, arthritis, fatigue, sleep apnea, gastritis, irritable bowel, asthma, allergies, PMS. How many of you know people who are on medication for these conditions? That should be everybody. They're treating with all this with drugs, right? And yet, every one of these can be tied to a diet or lifestyle cause. Why aren't they getting at the cause first? Because you could start cutting down the use of medication dramatically by getting at the cause. Part of the cause is this. This is real food, what I call ancient or real food. You notice how colorful it is, right? This is what we eat today, right? I'm right, am I not? People are eating this stuff, right? Sugar, white bread, chips. All you have to do is look on, watch TV, and you'll see commercials for all of this stuff. Notice the huge difference, right? They've taken the food out, the natural food out, and just left the calories behind. How many of you want to learn how to control your blood pressure with diet? How about control your cholesterol with diet? How about blood sugar with diet? How many of you just want to learn how to eat twice as much and still lose weight? Well, I'm going to show you right now. See, now some people just woke up, you know. I have 4 jars of food here. In this jar I have taro, brown rice, sugar, and fat or oil. For those of you who haven't seen this before, what is similar about the food in these jars? Somebody said calories. Very good. 200, 200, 200, 200. How many of you are surprised to know it takes almost 10 times as much food from rice or even poi to equal the amount of calories from sugar and oil? Aren't you surprised? I was surprised. But that's the reality. I learned this because when you all know I have a master's in nutrition, so we had to actually learn about food. And I measured this out and I went, oh my gosh, is this right? You know, I actually had to double check the weights on the scale, and I said, my gosh. And so this is what's happening. Remember I said we're eating lots more fat and sugar and refined flour, right? Well, when we eat lots of this, we're eating less food, but we're weighing more. That's why one of my first books is called Eat More, Weigh Less. I have a plate of food here, lots of oil here, lots of sugar, white flour. This beef is fattened up, all processed foods. How many of you could eat this in one sitting? I'm not saying if you would. How many of you could? It should be everybody. Because isn't this the standard American lunch? Right? They advertise it all the time. How many of you would still be hungry after eating this? You know, we want apple pie and, right? Okay? Now, how many of you could eat this in one sitting? It's 4 pounds of food. How many of you could eat 4 pounds of food all at once? Be pretty hard, right? A lot harder anyway, right? Okay, so what is similar about this plate and this plate? Calories. Very good. Boy, this is a very smart audience. But you know something? You're all wrong. This is less calories. Remember I said I would show you how to eat twice as much and still lose weight, right? I lied. This is 3 times as much. This is 1,800 grams compared to 600, and yet it's only 1,100 calories compared to nearly 1,200. Okay? Do you see what's happening to our food when we process it the way we do? I'm going to show you one more example. Here's an apple. Any dietitian will tell you a medium apple is 80 calories. 80. Okay? Here's a muffin. All right? How many of you could eat 2 muffins like that? By the way, this is a fairly large muffin. I bought it to be same size as the apple. Okay? How many of you could eat 2 muffins? It's just about everybody, right? I could. Now, if this is 80 calories, how many calories do you think are in this muffin? 300? Somebody said 300? Do I have 350? I feel like an auctioneer. 400? Do I have 450? It is 550 calories. Okay? I do this talk all the time. Every single time, people bid lower. They don't realize it's 550 calories for one muffin. Now think about it. If you multiply 80 times 7, that's 560. About the same as 7 apples. Okay? Those of you who could eat 2 muffins, how many of you could eat 14 apples? Because it's equivalent. It's ridiculous, right? Right? It's ridiculous. But I'm showing you this to tell you something very, very basic about your body and my body and about nature. Because nature will not let you get fat if you're eating whole, unprocessed foods. Do you know what I'm saying? I dare anybody to try to get fat eating apples. Because you cannot get enough calories in you because your stomach isn't big enough. And so all I do is I get people to eat the right kind of food and they lose weight automatically. Okay, do you know how I know this works? I know it works because stomach surgery works. Do you know what I'm talking about? Do you see the nonsense of our medical system? People are eating smaller food, right? They're eating oil and sugar and white flour, right? And the food gets smaller like I showed you. And do you know what they do? They slice you open, make your stomach smaller so it'll stretch. Right? With a little bit of food. They are making your stomach smaller to fit the artificially small food you're eating. I say, why not just eat bigger food? You get the same effect. I'm serious, right? It sounds ridiculously simple, but that's what I do in my programs. I get people to eat bigger food. And you know what? They all lose weight. In my programs, 100% of the people lose weight, even though they're eating as much as they want. And anybody who wants to challenge that, I have all the records. So I can say that. 100% of the people following my recommendations lose weight. And it's not because I'm so smart, it's because nature is smart. Because God made the foods right and made our bodies right. So in our program, you know, we have people who do this. Lost 150 pounds in 2 years. Took him off insulin.
When I started the program, I weighed 243 pounds. Currently, I weigh about 128. I'm kind of going in between the 125 and the 130. The other thing, too, the other day I thought, I think now my outside matches my inside. You know, now I look like how I feel on the inside. And that was kind of neat.
So,
yeah, my cholesterol used to be 223. Now, almost 2 years later on the program, it's 131. My blood sugar was a little elevated when we started, not much. It was just at about 100. I don't know what it is now. It was like 94. Yeah, I feel really good. If somebody were to ask me if they should do this program, I would tell them, yes, you should do this program. I would recommend this, definitely recommend this. And it's if you don't make it really complicated, if you just follow it, it's really not hard either.
240-something pounds, and now she weighs 120. Okay, this is to show you that it's not just a flash in the pan. It's not just, I get people to lose weight in 10 days or short time. People doing this properly can sustain the weight loss, okay? The average weight loss is about 10 pounds in 3 weeks. Actually, on a 10-day program, the average weight loss ranges around 7 pounds or so. I published the study, by the way. I published this. They actually ate more food, but their calorie intake dropped dramatically. What a surprise, right? When you eat foods that are much more bulky, you kind of lose weight automatically.
I just kept on eating and eating, and I was never hungry. I've never felt deprived.
I eat a lot of food.
My original weight loss was 45 pounds, 37 pounds so far.
I've lost 52 pounds.
I've lost 56 pounds, and I've kept it off for 7 years.
So these are people who are just eating and they feel satisfied and full, and they're still losing weight over time. And you can see on this woman, it's 7 years out. Actually, now it's almost 15 years, and she still weighs about 40 pounds less than she did. She gained a little bit of the weight back, but who doesn't gain weight as they age these days? Numbers all get better. Cholesterol improved, triglycerides, blood sugar, all improved. The interesting thing is we have other scientists who say, well, if you eat a high-carb diet like you recommend, triglycerides go up. But then my studies show that they go down. They say blood sugar goes up, but my studies show that they go down. Do you know what the difference is? The studies on the mainland, they use bread and juice and muffins, etc. as carbs. For me, I never use processed carbohydrates for my programs. I use virtually all unprocessed things like oatmeal and brown rice, etc. What you have to know is carbohydrates are not the problem. It's the form of the carbohydrate that's the problem. Okay, it's a very important lesson. I wrote a whole book about this called The Good Carbohydrate Revolution. You see, when you take an apple, for example, or flour, if you grind it up, you start having a completely different result. You start showing a different glycemic number. Same food now, same nutrient, same quantity, different result, just because you grind it up and change the form of it. So the way America eats, lots of processed grains, lots of white flour, lots of white sugar, is a serious problem. And by the way, oil is one of the most highly processed foods around. That's another problem. It takes about 1,000 ears of corn to make 1 quart of corn oil. So what is the one biggest mistake that keeps health costs out of control? Do you know what that big mistake is? The myth that pills make you healthy. Okay, if there's one message you get out of this presentation, is that it's a complete myth that pills make you healthy. Do you know what I'm saying? A lot of people go to the doctor, and there are great doctors out there, and they say, well, I'm doing what the doctor says, I'm taking all my medicine, so I must be healthy now, right? But you know what the sad truth is? The sad truth is, if you are on medication, by definition, you are unhealthy. Do you understand what I'm trying to say? And the doctors, unfortunately, are not really trained to get you off those medications. Right? They're only trained to put you on medication. And that's a tragic problem in this country. And that's what's really broken. The truth is, if you're on medication, by definition, you are unhealthy. All right? Insanity is doing the same thing over and over and expecting different results, said Albert Einstein. And yet that's what we're trying to do with our healthcare system. That's why we have a crisis. We're doing the same thing, and we're doing it over and over and expecting health to get better. I'm sorry, but it ain't getting better. And that's the big problem with our health system. If you want to see what's happened to another country that's gone through this, let's look at Japan. In Japan, they ate a very low-fat diet. Just like I showed you, they ate a very low-fat diet. By the way, you know that they have the longest lifespan and one of the lowest heart disease rates in the world, right? Well, it's changing. Because you see, fat intake has tripled, meat intake has tripled, rice intake cut in half. Now, isn't that what Atkins or the high-protein people tell you to do, right? Don't they tell you eat less carb, more meat, and more fat? Isn't that what they say, right? You've heard that, right? Okay, let's see if this was good for Japan. Because if this was good for Japan, then heart disease, cancer, stroke, diabetes should be going down, right? Well, Japan's food is now about 60% of the way to the American diet. They're eating more fat, more meat, etc., less rice. And cancer rates are going up dramatically. Heart disease rates are going up dramatically. These are different cancers: lung cancer, breast cancer, colon cancer, all rising. This doesn't look like much, but this is a 300% rise in cancer. And high blood pressure, heart disease, diabetes, hypertension, stroke, all are rising between 1960 and 1990. Now, do you think these recommendations are good for Japan, or this change was good for Japan? Absolutely not. But we can see by the change in the diet and the change in the health that there's a direct relationship. The systems are failing both in Japan and the U.S. because they fail to get at the cause of the disease. Let's look at heart disease. High cholesterol, higher the heart disease rate. Higher the cholesterol, higher the heart disease rate in different countries. Higher the fat intake, higher the cholesterol rate. It's actually very clear what's going on. Do you know what's one simple rule to find cholesterol in your diet? One simple rule. Anything that has a face on it has cholesterol in it. Do you know what I'm saying? Chicken has a face and it lays eggs, it's got cholesterol. A pig has a face, you make bacon out of it, it's got cholesterol. Now, I hasten to tell you that cholesterol is not the big problem, but the animal products are the vehicle for most of the saturated fat in this country, and that really is a problem, okay? Potatoes, apples, beans, corn, rice, 0, 0, 0, 0, 0 cholesterol. There is no cholesterol in plants. It's all in animals, okay? And again, I said, I just want to be straight with you. Cholesterol is not the biggest problem. Cholesterol in your diet is not the biggest problem. But beef, chicken, fish, cheese, etc., not only have cholesterol, but they're also high in saturated fat, which indeed is a problem. Now, many of you say, I've done this lecture and people say, well, Dr. Shintani, now I'm vegetarian. And I said, what are you eating? I'm eating cheese. And that's not the greatest thing for heart disease. So I recommend cutting down saturated fat, total fat, losing weight, reducing processed carbs, exercising, fiber and herbal supplements. And this is a person who went on my program.
I never went away from the meal feeling hungry or deprived. And that was one of the problems I've had with diets in the past. I always had to eat a lot less food, and I always seemed to be hungry, but not on Dr. Shintani's diet. When I first started this thing, my cholesterol level was about 235, something like that, and it went down 100 points in 3 weeks. I'm telling you, I was astounded. I've been trying to get that cholesterol down for years and years. It's never been that low. And all of a sudden, here it is, and all I did was change the way I eat, do a little bit more exercise, and basically do what Dr. Shintani said to do. And it works. And it worked fast. And that was incredible.
Okay, did you hear what he said? His cholesterol was about 235, and it went down 100 points in 3 weeks. Now, why do you need statins if you can drop your cholesterol 100 points in 3 weeks with a good diet and lifestyle? Right? Wouldn't that save everybody a lot of problems? What about hypertension? To control hypertension, same things. Control cholesterol, blood sugar, sodium, stress, exercise. All of these things are important. But here's somebody who was on my program following a good diet and lifestyle.
I've lost 52 pounds. I didn't have to take blood pressure medicine anymore. I just hate to take medicine. And it was such a relief not to have to take that medicine. My blood pressure stays normal.
Now, she was 72 years old. She was on all this blood pressure medicine. The medicine was making her depressed. It was making her retain water. She didn't like the diuretic, and she would retain water if I took her off it. And so it was a tough situation for her because some medicines, as you know, cause swelling, and she hated it. She followed the program, lost 52 pounds, and I took her off her medication, and it was a great improvement in quality of life for her. Here's another woman who followed a diet, who was on she was on 80 units of insulin. She's giving herself a shot 3 times a day.
How soon after you began the Hawaiian diet did you stop taking insulin altogether?
It was my second week on the diet.
You're kidding.
No, it was.
2 weeks out.
2 weeks on the diet.
We've done that with even worse cases, with people who had even more insulin.
Dr. Shintani published the results of his diet in the respected American Journal of Clinical Nutrition. In his study, the average dieter lost 17 pounds. Cholesterol counts dropped 14%. Blood pressure and blood sugar improved as well, all in just 3 weeks.
Okay, so you can see she was on insulin, right? We were able to get her off insulin, and when I say get her off insulin, I had to confer with her doctor. That's why I said, with your doctor's help. I conferred with her doctor and gradually winched her off of insulin to a point where she didn't need it. And I saw her, just a few years ago, and she still didn't need insulin. It's 15 years later. She still had to have oral blood sugar medicine, but it's a big difference taking pills compared to having to stick yourself twice, because you have to measure your blood sugar and then you have to inject the insulin. So it's a big difference for her. There was a very interesting study done in Norway where fat consumption went down, and I borrowed this slide from John McDougall. I guess it was around 1939. Norway got occupied by Germany, and they started eating less meat and fat intake went down. And guess what? Death rate went down dramatically. And it didn't matter whether you were 40 to 60, 60 to 80, or 80 years plus. It went down dramatically. You know what the point of this slide is? It's never too late to start. You see results almost immediately, like we do. I mean, I've run 10-day, 21-day programs, and I get people off their medication, actually, some of them very quickly. Of course, the results vary from person to person. I just ate 6 Happy Meals and I'm still depressed. Yeah, just calling it happy is not going to make it happy. But actually, people's mood change also with a good diet. I'm going to show you what happens in a very short time with diabetes, headaches, reflux, arthritis, fatigue. All of these people who require medication, who need less medicine. Not because we're trying to get them off medicine willy-nilly. It's because underlying it, they're getting well. And if you get well, suddenly your sugars are getting lower. I got to talk to their doctor and say, you know what, the blood sugar is dropping. Then the doctor has to back off. And that's the way to get people off medicine. Because I'm not against medication. I know one of the things you got to say, chronic disease medicine prevents the damage. You know, blood pressure medicine prevents somebody from blowing a gasket and having a stroke, right? But the point is, that unless you get people truly well, they'll never get off the medicine. And the fact that they're on the medicine tells you that they're not well. So I want you to see this short video on people following this program. As a nation, we're addicted to drugs, and I mean prescription drugs. And I mean it's like how damaging being addicted to a narcotic is to an individual. This nation being addicted to prescription drugs is wrecking the nation.
Tagamet, Depo-Provera, Lipitor, Avandia, Metformin.
Vicodin.
I eat Tums like Tic Tac.
1,800 milligrams of Motrin. Avalon.
I ask for alternatives to pills, and every time I go in, I get another pill. Plavix.
Captopril.
I'm going to have to be taking it forever.
My doctor said I'm pre-diabetic.
I would get migraines every single day.
I have a lot of lower back pain.
I had night sweats.
Extreme urinary frequency.
Immediate family, I'm the only one alive.
There's got to be something better than this.
I have diabetes and all those things that kill Hawaiian. I believe it's going to be my last effort here.
There are many people taking a lot of medicines that they could get rid of if they were following a good diet and lifestyle the way we recommend. Some people say, boy, your diet is dangerous. A diet makes people well so fast that their medication becomes dangerous.
88.
Oh, ouch.
You have Varicentral.
Yeah, skip it.
Skip that, okay.
Yeah. Actually, you should probably skip it.
Skip it?
Okay.
I'm so surprised. I can't believe it.
Being that it's on the low side of normal, you probably don't need your diabetes medicine.
I'm so excited.
Oh, why are you excited?
Pounds.
Oh.
I lost 14.
I've already lost 11 pounds.
So that means you've lost over
17 pounds.
your blood sugar was borderline, you know. Well, actually slightly high, 107.
Yeah.
Now it's 90.
Oh.
Yeah.
Well, but I had such a problem with reflux. Practically from the first day, it's been better. I have an unopened box of Prilosec.
Cholesterol was 228.
Mm-hmm.
And after 21 days, it's 141.
Wow. Wow. Yes.
Joint pain?
Oh, ankle, knees, hips.
Okay,
And since I've been off the dairy and off the meat products, nothing.
Your headaches?
Yeah, they're gone.
Okay.
I don't have any more headaches.
Thank you. So don't you all agree that this is a better way to practice medicine, right? Isn't this the way doctors are supposed to treat patients? Anyways, I started this program because I was so frustrated because they never taught me how to do this in medical school. And in fact, a lot of people don't know this, but I was a lawyer first. I was an attorney before I became a doctor. And I got fed up with the way law was practiced. So Sometimes I call myself a recovering attorney. And then I became a doctor, and I started waiting for them to teach me how to heal people. And you know something? I never found out in medical school. In fact, I saw all these patients with diabetes, hypertension, cholesterol, etc. You know, I was a lawyer. I thought it was malpractice because they didn't teach us nutrition. That's why I went to Harvard after medical school to complete my training, okay? So a lot of people think I got my master's first, but it was actually the other way around because I was fed up with the way medicine was practiced. So what is the health crisis cure? Diagnose the cause first. And unfortunately, you have to take charge of your own health and get healthy yourself because the health system is not going to do it for you. But when your numbers improve, your doctor will have to reduce your medicine. And that's how you improve your own health. Eat right, exercise, of course. I didn't talk about exercise, but positive attitude, the mental side is important. Sharing it with others, having a support system, and join a program like ours or the Vegetarian Society. And that's how you can get rid of the health crisis in your own self. I want to thank you for this time. Okay, now I'll take some questions. Yeah. The question is, previously I said that meat causes an insulin response. In my book, The Good Carbohydrate Revolution, I actually have about 37 pages of citations, and there's a study. You see, the big problem, let me give a little background so folks understand what the question is. High-protein advocates have said one of the big problems is insulin, which is true. High insulin levels cause metabolic syndrome. It causes high blood pressure, high cholesterol, high triglycerides. It's partly because they can't handle sugar. And so high insulin levels are a problem. And so they say, well, then you shouldn't eat carbs, you should eat meat instead. Well, if insulin is a problem, then why don't they tell you that beef raises insulin higher than pasta? And that's because they're assuming only carbohydrates and blood sugar causes insulin. Because many people realize that blood sugar will cause insulin to go up, right? Many of you know that, right? When your blood sugar goes up, insulin goes up, right? Because insulin is required to handle blood sugar. What most people don't know, and this is the problem when you have even doctors going out there talking about nutrition, they don't have a nutrition background, they don't realize that amino acids also cause insulin to go up. And do you know what beef is made of? Well, it's protein, which is made up of amino acids. And insulin levels go up just as much or more than pasta or oatmeal. Not as high as white bread or sugar. But if you want the citation, The Good Carbohydrate Revolution has it. I don't know it off the top of my head. But there's a study that shows what they call, you see, like the glycemic index, which shows blood sugar rise, there's actually an insulin index. Yeah. Okay, the question is, do many of my patients suffer from asthma, and do I notice an improvement? And the answer is yes. Actually, I wouldn't say many of my patients suffer from asthma, but I've had quite a few who have had asthma, and typically they see their asthma symptoms reduced. And part of there's a number of reasons for it. I could actually write a little book about that, because the kind of diet that I recommend in my programs are anti-inflammatory diets. And you know that asthma, one of the causes is inflammation. The other thing is we take away a lot of the allergens. We take away the dairy, for example. I don't use dairy in my programs because I know that they're highly allergenic. And we take away a lot of, we take away chemicals and junk and food coloring, etc. And people typically get well, even from stubborn asthma. First of all, if you're type 1, you have to have insulin. There's no choice. It doesn't matter what it does. Real type 1 diabetics will die with no insulin, okay? That's the definition of type 1. Now, they have a new category called adult autoimmune diabetes. which I don't know if that's the type you have, but typically type 1 diabetes is only when you're very young. But if you truly have this type of diabetes, it doesn't matter. You have to have the insulin, and you really don't have a choice. Now, as for the ankylosing spondylitis, which is another autoimmune disease, I had a person on my program who had ankylosing spondylitis. They followed the recommendations of the program, and the ankylosing spondylitis disappeared. You know, food allergies, man, I could write another book about food allergies. I mean, don't get me started. I'll tell you, one of the biggest concerns I have is GMO food, genetically modified food, because I'm starting to see patients who are vegetarian and they're reacting to soybeans because 70-80% of soy is genetically modified, and now they're getting allergic to soy that they were never allergic to before. And it's actually a potentially horrendous problem. I had a patient come in with fibromyalgia. She said, I've had pain all over my body since my teenage years, and I'm disabled now. She was like 29. She was late 20s, taking Vicodin and Percocet and all this, literally disabled. And the first question I said, how much dairy do you consume? And she stops. And she says, why did you ask? I said, well, that's part of my assessment. And she says, nobody's ever asked me that before. And I said, well, I think it's important. She says, well, I grew up on a dairy farm. I stopped her dairy. 2 weeks later, she was off all her pain medicine. It's amazing. And a lot of people who have back pain, I read a book once, I wish I still had the book, by a chiropractor. And he says, you know, my colleagues will kill me for this, but 70% of my back pain patients get well when I take them off dairy, even if I don't give them adjustments. How do you like that now? Chiropractor saying that 70% of back pain gets well without chiropractic adjustments if you just change the diet. I mean, it's a little more complicated than that. But anyway, I think we're all out of time. I want to thank you for this time together. I hope you will take it to heart.
Thank you, Dr. Shantani. I think we could stay here all night listening to him. I really appreciate it. Thank you so much for coming, and have a safe return home tonight. Mahalo.
This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet. Free monthly meetings include vegetarian experts found locally and on the mainland, quick and easy cooking demonstrations, and healthful and delicious food samples. Members enjoy an informative quarterly newsletter, social activities, and discounts at many vegetarian-friendly restaurants and health food stores. For an application, call 944-8344. That's 944-8344. Or visit our website at www.vsh.org. vsh.org.